nationally and statewide, there's a nursing shortage. We're feeling it here just like everyone is around the state and around the country.
Without nursing staff, without nurses, we really wouldn't have hospitals. Nurses are the ones at the bedside. They're doing the hands-on care. They're giving the medication hour after hour, day after day.
The LPN to BSN program, I've wanted to start for about the last 15 years. Historically, there just has not been the access to programs to help these LPNs get back into school.
Before I applied to this program, I was working, doing home health. I stayed working without, going back to school because there wasn't really any opportunities here locally. In the hospital, they usually want a registered nurse with a bachelor's of science in nursing.
We saw a need in the community. We knew it was going to take a ton of work, but we were going to do it.
Premera was there from the beginning. Without the funding from Premera, we would have struggled a lot more to get the curriculum developed in the short amount of time that we did.
We went with a holistic admissions model, which means, yeah, we're going to take a look at your grades and your test scores, but really we're going to look at your experience and we're going to look at your attributes, and we want to know who you are and where you came from and what your story is.
In healthcare and in academia, diversity, equity, and inclusion is a big part of the work that we're doing.
My mom was diagnosed with a pancreatic tumor. We're very, very blessed to have my mom still. Seeing how well that the healthcare team was able to help my mom really inspired me to be like, hey, I can give that to somebody else. I can be that for somebody else.
My father and my mother, they were migrant workers when we were growing up. They always instilled in me that when you're provided opportunities, take advantage of them and always try to give back.
Getting LPNs to that next level in their education and putting out a registered nurse in our community is just a huge step to help that crisis that we're facing.
LPN to BSN has maybe broken down some of the barriers of thinking that LPN was the end.
Obtaining my BSN along with my RN, I'm able to specialize and I'm able to have just more options and be able to provide, I feel like, more focused quality care for patients.
It's like that raising of all boats, where we work together as a community or as a neighborhood. Everyone has not just access, but has care.
When you think of lower income communities, what can we do? There's things that we can participate as nurses to make a greater impact.
Going back to the community where you grew up and worked there as a BSN, it would be a rewarding experience.
They're going to have so many opportunities because of this program to go even beyond what they think that they're capable of.